engaging the community since 1970. This is WIS Awareness.
Good morning, I'm Leland Pinder. Thanks for joining us on WIS Awareness this morning. And again, today we are talking about HIV and AIDS awareness. April kicks off a number of awareness and education efforts in our community and the nation. Here's a quick list for you. April 10th marks National Youth HIV/AIDS Awareness Day. April 18th, National Transgender HIV Testing Day. And there is a quick graphic to pop up with these dates here. May 18th, HIV Vaccine Awareness Day. And May 19th is National Asian and Pacific Islander HIV/AIDS Awareness Day. And June 27th is National HIV Testing Day. Well, all of this culminates in December, which is World HIV Awareness Month. And according to the South Carolina Department of Health and Environmental Control, 65% of new diagnoses as recently as 2017 were among African Americans. 22% were among white people. And so as we'll see more attention to this issue this month and in the coming months, there's also another virus we're all kind of thinking about. Of course, that's the coronavirus. So this morning, I'm joined by Dr. Bambi Gaddist via Skype. Good morning to you, Dr. Gaddist. How are you doing?
Good morning. You know, this is new for me.
Right. This is new for me, too. We'll kind of get through this together. You've, of course, been working in this arena for, more than 30 years, and a lot of people know you for your work in this field. So thank you for coming on and just sharing with us a little bit this morning as we discuss this issue. So kind of the first thing I want to ask you is about the coronavirus. Talk about, there's obviously a whole, set of issues and circumstances that deal with an HIV or AIDS diagnosis, and now dealing with the coronavirus. Can that virus affect the other?
So that's a very interesting question, and more recently there's been quite a few a lot of commentary around this topic. But let me just note in general, HIV and the coronavirus although they are classified as viruses, are not the same thing. One of the distinguishing differences is that, and I think it's really what we're so concerned about, is that the coronavirus is actually airborne. There's a lot of discussion about how it's most effectively transmitted. Some talk about droplets, but we also know that it is also, when we talk about aerosols, it means that it has the capacity to float in the air. And so a lot of our conversations are about how do we minimize the probability that we could acquire one of these aerosols in breathing it in through our nose, through our mouth, etc. HIV, on the other hand, is not airborne. It is not a virus that typically lives on a surface, as corona has been documented in doing. And so the whole issue and conversation around transmission is very important for people to recognize the difference. Now, when it comes to HIV, persons living with HIV versus someone who we would consider vulnerable, what's important, very important that people recognize, is that the recommendations that have been put out by the CDC and other authorities, Dr. Fauci, et cetera, they're really not that much different than what we're asking the general population to abide by. So, for example, they've asked us to avoid in crowds, being in groups of people. They've talked about 10, but certainly 3 is even a number that they've asked us to look at. They talk about washing hands, which is a critical issue. Wash your hands. Keeping your hands away from the face, out of the nose, or into the mouth. So these same prevention efforts that we're asking the general population to abide by is really not much different than what we're asking persons that have been diagnosed with HIV to live by. Now, I guess the final thing I would tell you is, because a person living with HIV has a vulnerable immune system, it's in that space that we really look at vulnerability, look at why it's important that persons living with HIV make sure they're taking their medications. Right. Eat well. avoid stress, and that includes people or situations that may cause undue stress to them.
Right, Dr. Gaddis, and with that kind of compromised or more susceptible immune system, is that kind of likened to an underlying health issue that we're seeing other people, being affected by that who are contracting the coronavirus? Is there a commonality there?
And which is why I appreciate this conversation, because so often when we think about vulnerable, we think about diabetes, hypertension, persons who've already been diagnosed with a cardiovascular or heart condition of some sort. But we rarely bring in the conversations around persons living with HIV who also have a chronic disease, that have vulnerable immune systems and are potentially susceptible. But what I don't want to communicate to your audience is that just being HIV positive in and of itself does not automatically place them in a high risk category. If they are taking their medications, and if they are looking at if they're virally suppressed, meaning that the virus is not producing at a level that would compromise their immune system, we want them to have a high CD4 count, and we want them to keep their viral loads down. And the way we do that is taking medication. And so those are the kinds of behaviors and supports that we really reinforce with persons living with HIV, versus creating a hysteria that makes them believe that they are much more susceptible to corona than anyone else in the community.
Tell us more about, who's affected by this. I had some information there at the top of the show about how new cases as recently as 2017 were largely among African Americans, and white people and Hispanics were much further down on the list there. But, aside from it being black people, is it women, is it men, heterosexual, homosexual, drug users? Who's really at the highest risk for this?
So we're talking about HIV, correct?
Correct, yes.
Okay. So, what's important is that South Carolina, let me go back to President Trump's initiative. Back when he was inaugurated, he talked about his intention to address this HIV epidemic in this country. He created, and we are currently looking at ending the epidemic. And in the reduction of new HIV cases, he proposed in his plan that in 5 years, we'd have a 75% reduction in new HIV, and within a 10-year period, we would potentially see a 90% decline. Well, what we know, Leland, is that 50% of HIV in this country can be found in 48 counties and 7 states. So let me repeat that. 50% of HIV in this country can be found in 48 counties and 7 states. South Carolina is designated as one of those states. And so we currently rank 11th in the rate of AIDS compared to other states. And Columbia, South Carolina, is currently ranked 6th in new HIV. And so from a racial perspective, the HIV epidemic is currently predominantly African American. As you noted, approximately 66% of the population, followed up with approximately 22% white. And I don't want to leave out the Hispanic population, because we have seen increases in that community as well. But there was a misnomer out here. There was a myth out here saying that black people couldn't get corona. But we now know that that's not so. And so on one hand, we may see a larger prevalence of HIV among African Americans in South Carolina. But if we haven't seen a lot of the data on corona from a racial perspective. So we do know that African Americans are capable of acquiring HIV and corona, but we really haven't seen a lot of the demographic breakdown of how coronavirus is impacting our community. So that's still a question mark for me.
And lastly here this morning, Dr. Gaddis, there is talk of this holistic approach to this issue. What is that, and how is that put into practice?
Well, certainly, the first armor that we can use is in prevention is knowing our status. With the corona, for example, the test measures infection. It does not measure exposure. So we really don't know who we're around, which is why they say to limit exposure. HIV is different. We know that there are specific things that we can do, whether it's knowing our status, knowing the status of our partners, making sure that we are aware of our overall health around sexually transmitted infections, use of condoms and protection are critical. We are still battling. We know with corona that there are very specific things that we also must practice. Washing the hands, avoiding crowds, not obsessing about masks, but trying to maintain an environment that's controlled, which is stay at home. And so these are two separate issues. They're similar as they are viruses, but we have to know and investigate, investigate and know what are the specific things that we can do to prevent HIV infection, and what are the things that we should practice to reduce our likelihood of contracting COVID-19 or coronavirus.
Thank you so much, Dr. Gaddis. I have to stop you right there for time, but just lastly, real quickly, if folks want to reach out to you or learn more, how can they do that?
They can call the South Carolina HIV Council Right Wellness Center at 803-254-6644, or just Google us, or our website, go to the right-wellnesscenter.org.
Perfect. Thank you so much, Dr. Gaddis. We'll be right back here on WIS Awareness with much more.
Let me tell you what happened to me. My family and I were hurt in a car wreck. That's when I decided to call George Sink Injury Lawyers.
My law firm will come to you and get started right away. Just call all nines.
Helping injured people is what they do. It's all they do. Call all nines.
Attention cancer victims who use the weed killer Roundup. A federal jury unanimously found that Monsanto's popular weed killer Roundup was a substantial factor in causing cancer. You may be entitled to substantial compensation. If you or someone you love used Roundup and were diagnosed with cancer, call the number on your screen now. Don't wait. There may be time deadlines to file a claim.
Call 800-213-0729. That's 800-213-0729.
This is the kind of card that has America talking. With it, people with Medicare are getting all-in-one coverage for their doctor visits, hospital care, prescription drugs, and more. This kind of insurance, called Medicare Part C, may also cover dental care, eyeglasses, hearing aids, fitness programs, vitamins, even healthy meals and rides to the doctor. With this kind of coverage, you do not need a Medicare supplement insurance plan. You will access your benefits through your Medicare Part C plan for one low and oftentimes $0 monthly plan premium. You deserve to get the most from your Medicare benefits. Call now for free information that may help you get more coverage for less money. There is no obligation to enroll, whether for yourself or someone you love. Call the number on the screen now. Call now.
When you're hurt in an accident, you're not the only one that's affected. Whatever happens to you, happens to them. Calling George Sink Injury Lawyers can help relieve you and your family during your time of need. If you're hurt, call all nines now.
Good morning and welcome back to WIS Awareness today. Our thanks to Dr. Bambi Gaddis for coming on a second ago. And now I'm joined by Dr. Markeisha Miller, still sticking with the same issue. Dr. Miller, of course, is a licensed professional counselor at Holistic Psychological Associates on Two Nights Road in Columbia. Good morning to you and thanks for joining us.
Good morning. Thank you for having me.
Happy to. So let's talk about mental health issues, of course, in the arena of HIV and AIDS patients. How are those different from issues that someone might be suffering that does not have that disease?
Well, we know that when we're speaking specifically about the HIV and AIDS population, we know that there are a lot of different barriers that come with that. There is the stigma that we're still working to destigmatize with individuals who are actually living with HIV and AIDS. And so with that, there is a completely different set of barriers that come into place, as well as we're also talking about helping those individuals learn to de-escalate that stress and avoid anxiety, because all of those things really play a hazard to the immune system.
And from your perspective, what are some of the different, tactics or ways you have to approach your patients who are all dealing with mental health issues, but again, some with this particular disease and others without?
Well, Leland, we still have individuals who are living with HIV, and they're still living in the darkness with that. We know that there's still a stigma. Many individuals who may be diagnosed with HIV or AIDS, but they're not speaking out. And with that, we know that they're not getting the proper treatment that they need to get. And so a lot of this really comes to getting those individuals to a very good emotional and mental place so that they can feel confident in seeking out the physical treatment that they need to be overall well.
And I was talking with Dr. Gaddis about, of course, the coronavirus, and that's obviously, front page news right now.
Yes.
And I'm certainly not comparing these two diseases, but it has been interesting to hear folks talk so openly and freely about COVID-19 and being diagnosed and the research around it, et cetera. And I've heard you say stigma a few times already in this interview. Do you think we'll ever get to that point talking about HIV and AIDS and, of course, people who suffer or who live with it, rather?
The hope is there. That is the hope. The hope is that people will get to a comfortable place where we're having open discussion about individuals who are living with HIV and AIDS. But, I think a lot of the stigma that is there is that there's so many myths or stereotypes that people have about who actually has HIV or who is more susceptible to obtaining HIV or AIDS. And so I think because of that, because of the stereotypes, because of the myths, I think that people are at this point, they feel safer living in the darkness with it. And I think that that is what keeps us from being able to give those individuals not just the overall physical treatment, but the mental treatment as well.
And I want to ask you the same question that I asked Dr. Gaddis last week here for this segment. Talk about this holistic approach quickly. In your view, what is that and how do we put that into place when dealing with this issue?
I'm a big believer that we have to approach health from 4 components: the physical, the mental, the emotional, and the spiritual. And so with that, there is this approach that if we begin to help individuals who are living with HIV, if we begin to help them to deal with their emotional issues, their mental issues, and really give them a full balance, the idea is that we're giving them an overall better opportunity to actually be well. So the holistic approach helps us to not just aim at just their physical being, but it helps us to really navigate in all areas of their life, which really we're finding to be very beneficial.
All right, we'll continue this conversation here on the other side of the break. We'll be right back here on Awareness.
It's bow time. The drive-thru's open and the food is real deal. Because no matter what else is going on in the world, we all gotta eat. That's why we've got your back with a big bow box that can feed the whole family for just $19.99. Bojangles, it's bow time.
Hello, I'm William Shatner, and you may not know this about me, but years ago, I was diagnosed with a sleep disorder. And like millions of others, I was prescribed sleep equipment. Did you know sleep equipment manufacturers recommend daily cleaning? That's why I use So Clean. It's the perfect complement to my daily routine, and it's hassle-free. So Clean is fast and easy. It keeps my sleep equipment fresh every day without the need for disassembly.
With So Clean, daily maintenance is a snap. All you do is place your equipment in, close the lid, and walk away. You can try So Clean risk-free for 30 nights. Order now and get a $50 rebate.
So Clean is so fast and gives you peace of mind that your sleep equipment is fresh each time you use it.
Call 1-800-713-4019. And for a limited time, get a $50 rebate. Call 1-800-713-4019 or go to SoClean.com.
If your windows are more than 10 years old, they could be drafty, difficult to operate, or costing you money on your energy bill.
The Champion family is here to help. At Champion, we design new windows specific to your home's needs. Then they are built in our very own factory, installed by a team of professionals, and guaranteed for a lifetime by our best-in-class warranty.
And right now, get 40% off your new windows. Call now for your free estimate or learn more at getchampionwindows.com today.
It's bow time. The drive-thru's open and the food is real deal. Because no matter what else is going on, you still got a hungry family. Bojangles has your back. Buy 20 Supremes and get 5 free all for just $25. It's bow time.
I'm that yellow haze, that allergy-inducing, car-covering menace that chokes the Midlands every spring. Pollen. I'll be with you for weeks. Think you can wash me off? Think again. I'll be back tomorrow with millions of my friends. You can clean me up, but you can't keep me away. So you best get used to me.
Don't let pollen spoil your day. We'll give you a heads up so you'll know when to expect the worst of it.
Depend on Dominus and the WIS First Alert Weather Team.
Welcome back this morning. I want to get right back to Dr. Miller. Before the break, Dr. Miller, you were talking about the holistic approach to the mental health, treating mental health issues with surrounding this issue, and how that benefits people living with this disease. And, of course, also it's preventative as well. How is that?
Well, you know, one of the things that we have seen is that oftentimes individuals may engage in risky behaviors. And we've seen evidence, we've seen a correlation that many times those risky behaviors may lead to individuals actually being diagnosed with HIV leading up to AIDS. And I'm speaking about risky behaviors with being promiscuous, drug addiction, just various things. But what we're finding is if we're able to get in there with a preventive measure and actually help people to develop better coping skills, help people to develop better ideas on how to address various issues that they may be facing, whether it be economical, whether it be just generational things that they're trying to work through. But we found that when we're able to help them with the cognitive approach, then we have a better attempt at preventing HIV.
And talking about resources here in our area, Dr. Gaddis briefly mentioned the Right Center, the Right Wellness Center, as a way to get in touch with her. What more can you tell us about that particular resource here in our community?
Yes, a great way, great opportunity for individuals not just to be tested, right? And I love Right Wellness, and what I really love about it is I call it really a whole holistic center where individuals can come in who may suspect that they may have HIV. Many times if an individual knows that they are interacting in risky behaviors, that may be the number one idea, or if you know someone, to come in and to be tested. And so with getting tested, getting the proper medication, knowing the proper diet, things that you should be doing, and now with our new implementation, having the mental health services that you need as well.
Do you have people approach you or come to you on their own typically for that mental health component with this, or are they referred to you by someone? Do you maybe have to go seek these people out? How does that work?
Well, here's the thing. Actually, in private practice, I do. I have individuals who seek me out because, and these are individuals who already know they've been living with HIV for years, and maybe they've never come to terms with it, and I often say that just because you've lived with it for a long amount of time does not mean that you have learned to accept it, that you have emotionally processed it, that you realize what it means for your life, or maybe, the things that you need to do differently. And so many times people seek me out. They come in, we do the treatment, we help them to go through many times a grieving process. And I say that intentionally because for many it is a grieving process. Not about grieving, I'm going to die, but it's about learning that there's some things that I'm going to have to do differently now. And I, often like to encourage people that it's about learning a new approach to life. And in order to embrace the new, you've got to grieve the old.
Absolutely. Thank you again so much, Dr. Markeisha Miller. I wish we had more time, but it seems like time is never on our side with this show.
I know. Always a pleasure.
But again, thank you so much for always being willing to come on. Want to pop up the details for the Right Wellness Center. If you'd like to visit, check it out, see what they offer. Maybe you can benefit from that, or you know somebody who can. Here's their address, their location, their phone number, their website, and just a short list of some of the services they offer. We'll be right back.
All right, 9 more steps.
Where are we?
Take a guess.
Is it a George Sink commercial?
Surprise!
You knew this was coming, but what you don't see coming is a car wreck or a work injury. I'm attorney George Sink. If you've been hurt on the highway or on the job, call all nines. We're here to take your call nights, weekends, 24/7. It's no surprise. Accidents can happen at any time.
If you've been hurt, call all nines.
Attention. The Centers for Medicare and Medicaid Services has officially authorized new benefits that Medicare Advantage plans may include. To get the benefits you deserve, you can call the Medicare Coverage Helpline.
Hi, I'm Joe Namath. If you're on Medicare, this is important information. I called the Medicare Coverage Helpline and they instantly looked up my coverage. In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments, private home aides, doctors and nurses' visits by telephone, and even home-delivered meals. The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
Don't delay. Call to see if the new benefits are available in your area.
Call the number on your screen now. It's free.
Call 1-800-973-1161. That's 1-800-973-1161 now.
Cardinals, hey, Dr. King here.
Every morning for the last 2 weeks, Dr. King has filmed a short video to share with his students on his personal Facebook page.
Check this out.
They hear his lessons, they're seeing him teach, they're learning, they're laughing. He makes you excited and you want to do the work.
These videos only take a couple minutes to do, and it's worth it to me if it touches one kid and makes them feel a little bit better about what's going on right now.
We are one. We are South Carolina.
Welcome back, and another quick thank you to Dr. Bambi Gaddis and Dr. Markeisha Miller for joining me this morning for this discussion. And a reminder for you, April kicks off a number of awareness and education events surrounding HIV and AIDS awareness. And here's a quick list for you on the screen. Lots to come this month and in the months ahead. And as always, thanks for joining us here on WS Awareness. We'll see you next time.
As your hometown